As you know, my dad is and was my role model in medicine. And here's a guy who trained in India. There was no CT, MRI labs. It was all about touch and intuition and the art of medicine, spending time with patients, like that picture we saw of the doctor who just had his hand on the patient. It's a beautiful thing. And when I shadowed him in his clinic, I would learn this. And I remember one time I was shadowing him, and he had a patient with right upper quadrant pain. And I said, Dad, like, we should get an ultrasound. You know, I'm a college student. He goes, does this thing that Indian dads do when they're disgusted, which is, don't be an idiot. Ultrasound. No wonder you Americans are spending the $2.8 trillion on the healthcare and getting worse outcomes in the developed world. You are burning money like it is growing on vines. I have two perfectly good 2 fingers. We will figure this out. Said, I gotta see this. Goes up to the belly, puts his fingers down, starts frickin' percussing right over the liver. The gallbladder wall is slightly inflamed about 3 millimeters. So I said, you know, medicine, that's it. I'm going to do internal medicine just like my dad. And I went on my rotation. It was UCSF. And just like these lovely medical students had the short white coat, made me look like a waiter. I practically developed an Erb's palsy just for a tip. And I never got it. And we're on the 3rd year rotation where only one of the 4 medical students on the rotation could get honors and get a really fancy swank residency. And so everybody's super competitive, big team, attending physician, for the purposes of this talk, let's call him Flanders. Because that was in fact his real name. And it's vengeance time. And Dr. Flanders said at the beginning of the rotation to the whole team, myself included, listen guys, we're here to learn. There are no stupid questions. Flanders was a liar. Because I asked a question to which he said, in front of the team, Damania, you speak and then think. I would like for you to reverse that. 2 weeks later, Flanders sits me down in the evaluation and he says, where to begin? And I was like, dental school? He said, look, man, Damania, the problem with you is you don't understand that there's a hierarchy in medicine. That you have a short white coat, I have a long white coat. You're making jokes on rounds. You're comfortable. You're acting like you're an attending. This is hurting you on this rotation. And then he said, but you know, I did something. I went and talked to the rest of the team, including the other medical students. And they said to a one that on rounds, you would use jokes to put everybody at ease, usually self-deprecating, and that you made everybody feel like they were an important part of the team, the most important part of the team. You treated everybody like they were equals, no matter what the length of their coat was. And then I talked to the nurse and the clerk at the front desk and the person who serves the food, and the janitor came up to me. And it turns out they all knew who you were, which was unusual for medical students, because you treated them like they were the most important person in the hospital. And then I talked to the patients, and they said something really interesting, that when you came in the room, you would sit down, and for the minutes that you were there, it was like nobody else in the universe existed except for them. And they felt heard and connected with. And that in itself was healing to them. And it was an exception to the experience they were having in the hospital. And despite my better judgment, I am forced to give you honors in this rotation. At which point a tear actually did start to come down. Then I sucked it back up. I wasn't going to lose my street credibility that easily, because then I'd have to kill a man to get it back, and I was not going back to jail. I'll tell you what I see after 10 years at Stanford when I see Winnie the Pooh. I see an anxious affect concerning for anxiety disorder not otherwise specified with likely depressive features. I see a black, partially necrotic nose concerning for chronic cocaine abuse. I see considerable central obesity concerning for insulin resistance with likely metabolic syndrome, confirmed and supported by the complete absence of fingers and toes on all the paws. suggestive of diabetic polyneuropathy with autoamputation. And despite his name, he hasn't. Concerning for diabetic gastropathy with constipation, and despite this litany of glucose-related disorders, Mr. Pooh's auto-amputated right paw is deep in the honey. And you're thinking, oh my gosh, nobody is incentivizing me to spend time with Pooh, to get at the heart of the matter, to go, Pooh, what hole in your life could that honey be filling that you have still got a paw in it, despite the fact that we've told you it's killing you? Could it be that as a society, we've taken honey that used to be in trees guarded by bees and put it in the supermarket and made it cheap in a food desert? Could it be that your social support system has fallen apart? Where is Christopher Robbins? He's your homie. He's AWOL. What's going on with Piglet? Is there abuse? Have you been getting into Tigger's crystal meth? No teeth, people. No teeth. What if I actually used humor, made these kind of engaging videos in a way that we could reach out to patients where they are? And I looked up the meaning of the word doctor. It comes from the Latin root docere, which means to teach. Was I teaching? Not really. Could I teach? What if I made some funny videos that had engaging hooks that focused on disease prevention and also satirizing the system so we could maybe rally people to do something about it? What if I put them on YouTube and just did that? And I ran it by my team and my department chair, and they were like, you will flush your career down the toilet. That is a very bad idea. Do not go on YouTube. And of course that made me want to do it even more. And so I got a PC, and I got a little handy cam, and I started recording these little parodies and editing them and trying to upload them to YouTube, and it was a complete freaking disaster. Like, I couldn't even get the thing to upload to YouTube. This was 2010. Then I got a Mac. "80 videos later, and millions of views, ZDoggMD with 2 G's because one is not sufficiently gangsta is in the house." And I said, wouldn't it be amazing? I wish that I could somehow translate this idea of engagement and prevention and sort of passion into the actual clinical space. Now, sometimes when you make a wish, and you wish hard enough, a fairy godmother comes down and turns your pumpkin into a chariot. And this fairy godmother is a beautiful princess-looking creature. In the real world, the fairy godmother often looks like a dude and is like this. So this guy is Tony Hsieh. And he says, look, man, I actually saw those videos you sent me. You need a restraining order. Like, that's not normal, son. But here's the thing. You're just crazy enough to be interested in something we're doing. I sold Amazon, made a bunch of money, stayed on as the CEO of Zappos. Why? Because I started studying cities. Zappos needed to grow. It's in the suburbs of Las Vegas. When you study cities, you realize when they double in size, they actually become 15% more productive per capita. Whereas when a company doubles in size, what happens? Like, what happens to Epic when it doubles in size? It gets less and less epic, doesn't it? So the same thing happens to companies because it's a pyramidal hierarchy, just like Flanders said medicine was, right? But in a city, there's no hierarchy. The mayor doesn't tell you where to go. You go where you're supposed to go. And then you bounce against other people in a dense urban space with lots of stuff to do. And serendipitous innovations spring from 2 interesting people colliding together and sharing ideas. And the more people you have in those spaces, the more innovation you have. And what would it be like if we took Zappos, this company that's poised to grow, and moved it from the suburbs where it's walled off like a Googleplex away from the community, and we dropped it into the heart of downtown Las Vegas. And he said, well, look, there's 18% of GDP that we don't understand because we're tech people and we're logical, and it's totally not logical. It's called healthcare. You clearly are crazy. You whine about stuff all the time in these videos about how broken the system is. Why don't you put your money where your mouth is, quit your job at Stanford? What if we double down or triple down on primary care? Instead of 4%, let's make it 8 or 12%. Let's start with prevention and primary care. Let's build a clinic, and let's fund it so that the doctors and the patients and the coaches and the nurses and the social workers have the time and the resources to practice at the top of their games. And so it looks like this. This is Andrew. He's a health coach. There are 4 health coaches to every doctor. A health coach rooms a patient for a 30-minute minimum visit. And there are 4 health coaches to a doctor, which means 4 patients can be roomed at a time at 30 minutes a pop. And then the doctor goes room to room to room and ties it together, practicing at the very top of their license. And it looks like this. Andrew was screened from 500 people we did in a speed dating thing. We got down to 2 that we hired. Andrew was one of them. Screened based on what? Empathy. The ability to get a story out of patients, to connect with patients. 60% probably of what we do in primary care doesn't even require a doctor. It requires a human being who can do what I used to be able to do as a medical student. Sit down and be present with that patient. And so what does it mean? It means, we were talking about patient satisfaction being an oxymoron. I'm not going to bore you with all the data showing outcomes in a year. I'm going to show you the most interesting outcome. Net Promoter Score. How satisfied are patients in the first year of us being open? How likely are they, on a scale of 1 to 10, to recommend this clinic to their family and friends? Turntable Health, 90% positive Net Promoter Score. You can compare that to Amazon, and then a healthcare benchmark, which is a large HMO out west that has one of the highest Net Promoter Scores at 35%. It shows you that we might be doing something right because patients are happy. The outcomes, I won't bore you with, but I'll show you the net cost outcome in a year in a sick population of patients, inclusive of $80 per patient per month, higher rates for primary care. They're normally like 20 or less in Vegas. We saved, oh, sorry, I forgot, Comcast cable. Oh, where'd that come from? I just made that up, but it feels right, doesn't it? This is a vision of health 3.0, and the emergent from that is even more, it's an almost sacred thing where that human relationship, that analog relationship comes back. And that's what we're trying to do. And couldn't you imagine the 100-acre woods in a world like that? He still has no teeth, to where if my daughter were to come to me now and say, Daddy, I want to be a doctor, I would tell her I couldn't imagine a more sacred calling where every day you give a piece of yourself and you get to be with people that are at their most vulnerable, who give you their story, and both of you are transformed by that encounter. And a positive wave spreads through the community, affecting countless lives every single day. Lather, rinse, repeat. What a gift it is to be a healer. Unfortunately, since being in Las Vegas and watching my videos, she now has different career plans.